Hi, I'm Ruthie Reaux, and this is going to be a little video on how to perform a forearm splint on a fractured bone. So this is our victim, Raimi. Whenever I first get to the scene, the first thing that I would do is call an AES system. So I would find a phone, call 911, and tell them any information about the victim that I can and give them the help that they need. And then next I would assess the victim. So I would be assessing for major life-threatening conditions, like severe bleeding, allergic reactions, anything like that. And then I would ask for consent to make sure that the victim allows me to take care of them and provide care. So is it okay if I take care of you today?
Yes.
Okay, perfect. So in this situation, it's going to be a forearm fracture, like right here. So we're going to be providing her with a splint for better stability. So the first thing that you're going to want to do is have a splint board. And typically there's going to be like a soft side and a wooden side. And you just have to make sure that the soft cushion side is on her arm. So first we put her arm in the splint like this, and I guess typically we'd have someone else helping and they would kind of hold it in place while I'm getting the other supplies, and you just want to make sure that her thumb is also in the upright position for whenever we actually wrap the sling. And then we're going to need like 3 bandages. The first one we're going to tie around above the area of fracture. So for fractures right here, we're gonna do like above the forearm. And we're gonna start at the bottom. We're gonna bring it up, bring it over, and tie the knot at the bottom because you don't want the knot to be on the victim's skin. And also, at the bottom, you're gonna tie a surgical knot. And just make sure that it's secure enough so that the splint stays in place. Next, you're going to grab another bandage, and then this time we're going to go below the fracture, so kind of near the wrist area. We're going to start below, go above, twist, bring it back down, make sure it's secure as well, and then a surgical knot at the bottom once again. Okay. And then the last one is to secure her hand to make sure that her wrist isn't able to move, because that'll move the bones and cause further injury. So we're gonna start at the bottom again, and we're gonna go around the thumb. So just make sure their thumb is kind of sticking up, and then you're gonna wrap it back down, do the exact same thing. This one doesn't have to be as snug or as secure, just has to be a little snug. To make sure it stays in place. Surgical knot again on the bottom. Okay, now that her arm is secured on the splint, now we're going to apply the sling. So you're gonna need a triangular wrap just like this, and then we're gonna place it under her with the corner going this way and this part above her shoulder. And then we're gonna take this bottom piece, kind of just wrap it around her arm, and then we're going to secure it in the back of her neck. You can also use some padding in the back or on the patient's neck if you have that. So you just kind of want to make sure that it's straight and secure and comfortable for the patient. That. Next, you're gonna have this little elbow piece that's kind of just gonna be hanging. So you're gonna wanna secure that as well. So if you have any type of bandage or a safety pin, you can use that. So we'll take the end and we'll bunch it together and secure it as best as possible. Okay, now that the sling is secured Next, we're gonna swathe the arm. This is to make sure that the sling doesn't move around, preventing further injury. So for this, you're gonna kind of just take another cloth similar to the one we just used, but bunch it all together like this. And then we're gonna start on this side of her arm, like right below her shoulder. And we're gonna bring it around her wrist right here. Make sure not to hit the fractured site. And then we're gonna secure it right under her armpit area on the side, like this. Just make sure that's secure. You can also tell them to take a deep breath to secure it deeply if you feel the need. And that is the end of making a sling. So she should be secure at this point. She would go and get, hopefully the AES would be here and pick her up, put her in an ambulance, and then bring her to the hospital. So this would keep her secure until getting further care.
It's laid!